Assalamu alaikum, my name's Nyrah, I'm a GP pharmacist and I'm your host for today's health show. I hope you all have had a wonderful Eid with your family and a very spiritual Ramadan. Today's show we will be talking about two topics which are one of my favourites. It's pigmentation and also the skin aging process. I have invited a very special guest to talk about these two topics. Now, pigmentation, I know it's pretty common in the South Asian community, so I thought it'd be great to discuss some products out there and address some myths. And as you know, skin aging is inevitable, happens to all of us eventually. Some may age more gracefully than others, but it would be nice to talk to our lovely guest, Dr. Amina, with great experience to talk about some tips. Hi, Dr. Amina. Thank you so much for coming on the show.
Hi, Nyrah. Thank you for having me. I'm Dr. Amina, for those of you who don't know me. I started off life as a hospital doctor and then moved on to general practice all 22 years ago, 21. I have loved skin, and for the last, I'd say 12 years, I've been interested in skin, and that's what I've been studying. And today's topic, well, it is one of those topics that everybody is interested in because we all have to go through it. Really, aging is one of those things that none of us can escape. And then some of us also have trouble with pigmentation, which can be quite troubling and costly as well when we're trying to treat it, if you can find somebody who can treat it successfully.
So what is pigmentation?
So pigmentation is a process. So pigment is the colour that you get in your skin. There are cells called melanocytes that produce colour. And what naturally should happen is that your skin should produce a set amount of colour that is normal for you, determined by your genetics, and it should arrive at the skin untouched and then look nice and even over the top. What happens in pigmentation is that things go a bit amiss. So instead of having like an even tone, you'll start to notice some areas look darker than others. And that can be quite upsetting for a lot of people, particularly if they have to then use things like makeup to cover it up, because it can really affect self-esteem and confidence. And because of that, people can get quite depressed. Some of the things I hear are where people don't like to want to go out because they're worried about people noticing their skin, or they feel reluctant to go out because they know they have to put lots of makeup on to cover it, and they just on that day might not have the energy to do that. So treating can actually be really good for the mood. And one of the other things that I hear quite often is, if somebody has pigmentation, they really struggle because when they have to do their ablutions, they have to remove it all, do the ablutions, and then some of them are so underconfident they have to put it all back on, and it's a huge time it takes a lot of time basically. So some of them, we've helped them, they've been really pleased because it saves them a lot of time.
Definitely, it's really important that we are talking about, that self-confidence, because skincare is a really actually important part of, our appearance, which is obviously going to affect our confidence levels as well. And, touching on gender now. Now, does pigmentation occur equally in both men and women? Can it affect men as well?
Yes, of course it can. And to be fair, when it comes to men, I tend to see them when it starts to become more severe. With women, we tend to look at our skin, we tend to use makeup, so we're aware of what's going on. With men, they don't like to ask for help. And often they'll ignore something until others start to comment. And then they start to come in. And sometimes it's when their own wives or family members will say, actually, do you think you might want to go and get some help for that? and that's when we'll start to see men come in.
And what factors actually worsen pigmentation? So, are there actually things that you can do to avoid making your pigmentation worse?
So one of the main factors is actually not protecting your skin in the sun. I know you hear dermatologists, cosmetic dermatologists, clinical dermatologists harping on about sunscreen, sunscreen. It's important. Pigmentation doesn't just happen overnight. It's not like you didn't use SPF yesterday and so today you are going to have pigmentation. It tends to be a cumulative thing. So one of the messages I want to get out there is, if you have children and if you have pigment prone skin yourself, then you need to make sure you protect your children's skin, because although they might not get pigmentation immediately, gradually over time their skin will become damaged. So as they're older, they'll start to have pigmentation, and that carries a big burden, psychological and financial. So SPF 50 in summer and 30 and above in winter. Now, yeah, you might think it's winter, it's England, there's not a lot of sun, but the damaging rays are there. And I actually learned that myself. When I was 32, I was diagnosed with stomach cancer and I had to have some chemotherapy. Whilst I was having that, my skin became super sensitive to the sun. And I thought, when I'm going out, I'll put sun protection on. One day, I hadn't put it on inside. I'm sat down in the shade in the living room and my skin burnt. I actually had a burn on the side of the face, which was towards the window. And it made me realize, just because I'm not in direct sunlight, just because I'm indoors doesn't protect me from damaging rays. So I kind of inadvertently ended up protecting myself to prevent the burning. But it was a silver lining, because it's helped me get into the habit of using sun protection every day. And over these last 12 years, it's actually really benefited me, even from the anti-aging benefit that sun protection has.
Yeah. I'm so sorry to hear about that. I think right now, of course, I think everyone can see, skin does look very gorgeous. And,
Thank you.
really important that we do actually educate everyone to wear sunscreen also indoors rather than just outdoors. Sun rays do travel, they do cross walls and the furniture, etc. So it's really important to wear that sunscreen. And
it's not just for pigmentation as well. There are cancers, skin cancers, that are linked to unprotected skin. So although we are Asian, and yes, we do have more melanin, the risk is lower in us, it doesn't mean it's completely like non-existent. So there's lots of benefits of using sun protection. And actually, when we were growing up, most of us were told, oh, moisturize, moisturize. If you don't moisturize, your skin's going to get old and wrinkly. Well, it's not true. Moisturizer's not essential, but SPF is. So actually, what we should be telling our kids is SPF, SPF. You don't use SPF, your skin's going to look old and wrinkly as you grow older, because that is actually the fact rather than the moisturizing side of things.
Definitely important take-home message. Have SPF in your covers if you are going to start a skincare routine. And coming back to pigmentation, can pigmentation be cured or reversed? What things are out there to actually really help patients with pigmentation?
So there are a lot of things out there. Some are medical grade and some are non-medical grade. The more effective things are medical grade, but they're not for the faint-hearted, in the sense that treating pigmentation isn't one of those processes where You put a cream on, you look fresh, you smell fresh, and nothing changes except that your skin looks brighter and brighter. With pigment, imagine them as little sort of bags of colour that are interspersed throughout your skin that have leaked out of the cells. What we need to do is stop the leakage and push out the colour that has already leaked. And so what we do is we use a number of medications, some that block the colour into the cells, some that prevent the cells from producing too much colour, and others that encourage some of the cells that carry the colour to divide better. And in essence, they almost act like as if they push the colour to the surface, the skin starts to look a little bit darker, and then the top layer, the dead layer of cells, peels away, and what comes out underneath is fresher and clearer.
Brilliant. Thank you for that explanation, Amina. We will be coming towards a break very shortly. Discuss more about pigmentation. It'd be nice to talk about skin aging as well.
Yeah.
Thank you so much for giving us a really into pigmentation. I think key take-home messages here with pigmentation is that it is really and stuff. Thank you. Welcome back after the break. My name is Nyrah Saleem and I'm your host for today's health show, British Muslim TV. Now, in the first half of the show, I introduced our amazing guest, Dr. Amina, and we're discussing pigmentation. I thought for part two, let's actually change the topic to skin aging. As I said before, it's inevitable. We're all going to age one day. Some more gracefully than others, but I know there is a lot of tips out there to actually slow down that skin aging process. I'd love to kind of discuss what skin aging is and how we can actually improve our skincare routine. So, Dr. Amina, what is skin aging? What does it mean for our skins to age?
So over time, our skin loses its elasticity. What is elasticity? It's like a rubber band. It's the ability when you pull the skin for it to sort of snap back where it was. It also loses its volume. And what that means is the skin gets thinner. Now, I kind of think of it like a balloon, as odd as that sounds. If you have a balloon and you pump it up so it's fully inflated, that balloon looks really nice and shiny and radiant. You can't twist or bend that in any direction, so you don't get any lines on it. It looks smooth. However, if you start to take the air out of the balloon, you can then start bending that balloon. And the more you bend and twist it, the more likely the lines stay. And then actually, as that balloon remains with less air, it loses its elasticity, so it doesn't sort of pop straight back. It becomes a little bit saggy, and that's what happens with skin. Now, in terms of aging generally, let's say our face, there's a few things that cause the aged appearance on the face. It's not just the skin that ages, it's actually the bones, the muscle, and then the skin as well. So as we get older, our bones are not as strong, as big as they are. So as women particularly get older, we lose one of the hormones called estrogen, and that hormone really looks after our bones. So when the bones aren't as strong as you would want them to be, then they start to get thinner. As they get thinner, the skin hangs from that area instead of being pushed out. One of the analogies I use with my clients is that if you have an absolutely beautiful dress, if it's in an adult-sized hanger, it looks right. The shape looks perfect. The bottom, when you look at it, it's the right shape. Put that same dress in a children's hanger and the bottom parts of it start to hang. Now, if you start looking around at an older woman, you'll start to notice that instead of her face being like this pointy where the volume's mainly here and the chin is pointy, they start to look like their face is a little bit more square. Because the skin starts hanging, it hangs at the bottom, and that volume sort of turns upside down. So this is where the volume ends up, where you have less up here and more up here. And when the skin is also then not as elastic and it's not as plump, you start to see lines and folds in those areas where the skin isn't pushed out as much as you would want it to be.
That was a really interesting analogy, and it's quite interesting actually, because it makes me think, is a lack of maybe vitamin D in your diet, or those with vitamin D deficiency, which leads to, for example, weakened bones, could that also be a factor which leads to a faster aging process and leads to, you know, more drooping of the skin? Because I know a vitamin D deficiency is quite common in the South Asian community. You know, what are the factors that speed up the aging?
It's very common, and it's very common because the melanin in our skin actually protects against the sun, but then it also means that we need more sun to produce vitamin D. Now, vitamin D is very important for bone health, and generally, if you are low in vitamin D, you are going to start to feel a little bit achy. You will get bone aches, but also muscle aches and pains. And there isn't any direct research related to it, but common sense would tell us that if we haven't got the ingredients to make healthy bones, our bones aren't gonna be in as good condition as somebody who has a normal vitamin D.
Definitely, and I think the UK requirement for the vitamin D in all adults is actually minimum, 10 micrograms per day. So, if you are watching this, I would actually recommend to start a multivitamin pack and have that minimum vitamin D requirement. It's not that sunny in the UK, that's why it's even more important. And moving on, you mentioned skin elasticity, that obviously declines as you get older, which also affects, the drooping of the skin, the wrinkles. What advice would you give to someone, an adult, that has a very simple skincare routine? Are there any specific products that you'd recommend for them to add to their skincare routine or to avoid?
Yes, definitely. I would say that you need to consider what are called the vitamin A derivatives. You might have heard of things like retinol.
Yeah.
They're quite important, but I would say that they're more for younger skin. So I'm talking about between the ages of about 25, 30, 35, where it will make a difference. As you get older, you need something stronger, and often those are prescribed. They're in the same category, but they are prescribed because they actually change the skin. And the rules, as you well know, are anything that actually changes the skin must be prescribed.
Sure.
But they do work wonders. I have clients who look 10 years younger, who've struggled with their skin, and without needing any sort of injectable interventions, actually their skin is tighter, plumper, and they look good for their age. So instead of looking a little bit, like they've had a rough time of it, they look like they've spent years looking after themselves. And that's what we all want. And that's what my aim generally is when I'm looking after my clients. I want them to look really good for their age. So when they get that reunion message, they're like, oh yeah, I really want to go because I feel good about myself.
Sure. So you generally recommend, retinoid-based cream. I know there's so many anti-aging creams out there, a lot of creams, have a lot of promising benefits, of course, on the adverts as well. Are they a waste of money? Are anti-aging creams just a gimmick? Are there any ingredients that we should specifically look out for rather than just the retinol-based ingredient?
To be honest with you, I think there's a lot of clever advertising when it comes to cosmetic products, but legally, they're not allowed to put anything in the products that actually change the skin. So anything that does change the skin has to actually be prescribed. Now, for younger skin, it doesn't need as much. And when I say younger skin, I'm talking about young girls in their teens, in their early 20s. But as we get older, we need that little bit more. And I would say, in terms of anti-aging, everything I've looked at that's non-invasive, it's actually the retinoids that really have an evidence base that are proven to be anti-aging. If you look at when they were introduced, some of these were originally introduced as sort of medical treatments or clinical treatments for things like acne. So they have a lot of data, and when people were asked or the research was done and those people were looked at 10 years later, 20 years later, it sort of became quite obvious that those who had been on the retinoids looked a lot younger than people their own age who were living in similar circumstances. So the sort of anti-aging benefit became quite obvious, and that's when it moved from being sort of like a acne treatment alone to being a more sort of anti-aging treatment as well.
Yeah, no, very, that's really important as well when it comes to skincare, is that are the products, evidence-based choices. And that's quite an interesting, study that you included, because I've also read about, retinol in combination with SPF. It's pretty good combination. Yeah. I always say, my mum actually.
Desert island duo. So if anybody said you're going to a desert island, you can pick two things. It is literally retinoids and SPF.
Definitely. Even my mother says, when it comes to skincare, less is more. And that's absolutely correct, to be honest. So I think that's a good other take-home message to maybe save your money in terms of, don't go out there, go crazy, I'm going to buy this, I'm going to buy that. Shop smart when it comes to skincare.
Yeah. Because a lot of my clients will actually say that they have spent lots and lots of money, a little bit here, £20 here, £30, £40. By the end of it, you end up, and I was guilty of this as well, where you end up with lots of creams, can't use them all, feel too guilty to throw them away because you spent money on them, and you're like thinking, well, how am I going to use all of this? And so it's better to shop smart and get the right products for you. Don't start buying lots of different creams that you've used once or twice, because using something once or twice isn't going to tell you whether it works or not. Our skin cycle is actually 42 days, so it's 6 weeks before the cells that are first born at the bottom of your skin actually get to the surface. So whatever you use that's actually that clinical grade, you're not going to see the difference for a good 6 weeks. You might start seeing changes, but the real, change you're going to see would be at that point.
Oh, thank you so much, Dr. Amina, for actually coming on to our show. Gave us really good insight into these two topics. Sadly, we are coming towards the end of the show now. I'd like to actually summarise, what we kind of actually discussed. Part one, we talked about pigmentation and importance of SPF, and part two, aging process, importance of vitamin D, taking your minimum requirement, and of course, starting a retinoid base. Thank you so much for tuning in another topic. Nyrah, watching.